the vulnerable enrollees who depend upon Medicaid will continue to get it. You say that you want to protect them. How can you make sure that they will be protected?
I took this job to do just that, protect our most vulnerable. And yet, the plans that I've been asked to preside over, Medicaid and the Affordable Care Act exchanges in particular, are not stable programs. Medicaid spending has increased 50% in the last 5 years. And a major driver of that are the able-bodied individuals who joined the program, and half of which these individuals don't work, and many of them could work. I actually think work is a good thing in general. The economy needs more people to work. We've got twice as many jobs as there are people seeking them. But in particular for Medicaid, the problem we run into is if we allow able-bodied individuals on Medicaid to get a 90% match from the federal government, states game the system. So let's go over the several accusations that I heard in those several packages. First off, we already know what happens when you take people off Medicaid. We just did it for the last 2 years. Under the Biden administration, 15 million people were disenrolled from Medicaid. 15 million. The uninsured rate went up about 10%. Went up 1.5 million people. So the vast majority of Americans, and I have confidence in the Americans' people, if you give people a chance to work or volunteer, participate in your community, go get an education, or lose your insurance, they take the job over that. And so the estimates that we're seeing are made by economists, but it's a behavioral analysis. It's a psychology analysis. Will you take the deal?
It is the Martha Zoller Show, and this is Dr. Oz explaining to Jake Tapper. And look, Jake Tapper's doing it. Every part of the mainstream media's doing it. My dear friends, Patricia Murphy and Greg Bluestein are doing it. Now, to be fair, you wonder what that is on the Martha Zoller Show. What are they doing? To be fair, writers don't put their own headlines on things. We do because we're a small shop, okay? But in general, writers of articles at places like the AJC or whatever do not put the titles on there. Do not put the, sometimes that gets changed. And why does it get changed? It gets changed because they want clicks, okay? They want eyeballs. So they'll say people are being thrown off of Medicaid. People are out there. And Dr. Oz pointed out, okay, 15 million people left Medicaid during the Biden administration because they went back to work. And they were given a choice. Either you go back to work or you lose your insurance. So it's not a crazy thing out there. It makes me so mad today because we are not cutting Medicaid in the big, beautiful bill. There may be things in the big, beautiful bill that you don't like, and we can talk about those. But they are not cutting Medicaid. They are slowing the growth from $400 billion a year to $200 billion a year. That's still more people being able to get on Medicaid, just not everybody getting on Medicaid. Now, I had a conversation this morning with my daughter on the way in about universal health care because she's more left than I am. And, it's one of those things. And so we were talking about it. And the big challenge is, I think that if you look at systems around the world, I don't think there is any denying that we have, as far as treatments available, the best system in the world to the most people. Okay? Because we will do things to people up until the moment of death if we think that it'll give them a little bit more life. We don't ration health care. We really don't. We do lie to people, though, in saying if you don't have insurance, you can't go to the doctor, because there are all kinds of ways, and I'm just speaking about our community, but I know it's true in every community I've lived in. There are things like Good News at Noon. There's a health department clinic. There are places for people that don't have insurance to go. An emergency room is not going to turn you away. And I guarantee you, if you went to a doctor's office because you needed a primary care doctor, they have a primary care clinic that is not the emergency room over at Northeast Georgia Health System where anybody can be seen in our community. But I guarantee you, regardless of where you're listening to me, if you went to your primary care doctor and you said, I'm going to be a cash pay patient because I don't have insurance for whatever reason, I know in our own company that we have, where we have a small group, it is very hard to find small group policies right now. It is very difficult to find these small group policies. And there are people out there that are working that don't have insurance or don't have as much insurance as they would like to have. Because we look at our insurance as a health financing plan and we think we shouldn't have to pay anything. And I think that's one of the big mistakes and why costs have gone up so much. Okay, but that's a discussion for another day. But I guarantee if you went to a primary care doctor and you said, look, I'm going to self-pay, but I really need to have a primary care doctor, because everybody needs to have a primary care doctor that knows your history. The greatest indicator of you living a long and healthy life is having a primary, all the normal things you eat right, you get enough sleep, all the things that you don't do. Okay. But as far as medical care goes, the greatest indicator to you having a long and healthy life is having a primary care physician that knows your medical history and that will make good decisions on your behalf and help you make decisions about your health care. But I guarantee you, if you go into any primary care office in my listening area and you said to them, hey, I'm going to be a self-pay, I would like to know, how I can make that happen. They all have a plan for somebody to be a self-pay. Now, if you can't afford it, there's something like 160, I could have the number wrong, health departments all around this state. There are places like Good News at Noon in many counties around this state. There are clinics that we're now building in schools in areas where they don't have many doctors. Okay, there are ways to access health care. You might have to do a little bit of digging to find it, but there are ways to access health care. That's the biggest lie we tell people. But if we could take away all the craziness, which is like transgender surgeries are basic health care. That's not basic health care, okay? What they do in France, my cousin who spent his whole life doing healthcare policy, he said everybody looks at the NHS. The NHS is not the model. Because England is no different than anywhere else. Everybody's on the NHS, but the rich people have their own policies and their own doctors. And that's what's going to happen in any, quote, universal health care situation. But what he said and what I've done the digging in and what I've looked at is while we have the best health care system as far as choices, we do not have the best health care system as far as delivery. Okay? So he told me, my cousin told me, look at France. So what France does is they have basic health care, which is all your annual checkups, any kinds of drugs and treatments that come out of those annual checkups, including chemotherapy and that kind of stuff. Treatments based out of your normal visits that you get are all included in what you pay to the government. It's basic health care. Then you buy a policy, and they have all different kinds of policies to cover anything that's not covered under basic health care. And it depends on how much you buy is what you get. That's the best system in the world right now. And as far as, and they do have longer life expectancy than we do. They do have other things going for them. So, I know the healthcare thing is a major issue, but these people are lying to you. Medicaid is not going to be cut. More mothers and children and single parents are going to be able to get help because we're not going to be giving Medicaid to every illegal immigrant that comes in. That's called efficiency. And what drives me crazy is the people that oppose what Donald Trump is doing related to efficiency will say, oh, well, it's not that we don't think we need to cut anything. We just don't like the way he's doing it. Well, what you're actually saying is there is no waste, fraud, and abuse in the federal government. That's what you're actually saying. There is waste, fraud, and abuse, which means that if you get rid of it, the amount of money you are spending is going to go down by definition. Folks, I think we need to go back to school and basic math.